Good afternoon and welcome to 25 Minutes with Cap. Today we're going to discuss what's new in the hospital professional liability market. Now, this is a market that has gotten increasingly under the microscope over the last 2 years. Softening pricing, expanding terms and conditions, and all of this coming to a head amidst the uncertainty brought by the external forces of COVID-19. There seems to be more questions than answers, and that change and more change is afoot. Will this business go the way of excess casualty and public D&O, with rapid limit crashing and price increasing? Or is there nothing to see here? Has pricing already peaked? Is there more runway? So who better to discuss this with us than Senior Vice President and National Healthcare Placement Leader at Marsh, Paula Sullivan, and our Director of Hospital Underwriting, Christina Langenstrass. Paula has been in the space for over 30 years and currently is responsible for negotiating coverage terms on behalf of healthcare clients, or as she referred to it, beating up underwriters all day long. And Christina has been in the healthcare business for over 15 years, all of them in the healthcare space. As we go on from here, as you have questions through the session, feel free to enter them into the chat and we'll do our best to answer them. We already received a few and we'll look to address them in the next 25 minutes. Lastly, just a reminder that the content of this webinar is the property of CapSpecialty and is for informational purposes only. You're not permitted to republish, share, or quote from this webinar without the prior written consent of CapSpecialty, which can be obtained by contacting marketing@capspecialty.com. We hope you enjoy the webinar. So first, Paula and Christina, thanks for joining.
Sure, thank you.
Great. So Paula, let's start with you. Is this a hardening market?
So, I think maybe start by defining a hard market. And, sure. It's characterized by significant rate increase, increased retentions, adverse modifications to terms and conditions, such as new exclusions, non-concurrency on layered programs, or material reduction in global capacity for a given line. And while we're seeing all of that, or some of those factors still, we're definitely seeing them to a lesser extent than we did in the last 18 to 24 months. And I think there's a few reasons for that. One being that we've already seen some significant material changes our clients have already taken, from a risk transfer standpoint, increased retention, large rate increase over the last renewal season or two have really put, I think, markets in a better position of profitability. So I think that's the first part of the answer, and the second part really has to do with the influx of capacity we've seen specifically in the medical professional liability space. If you look over the last 2 years or back to early 2019, we've seen 11 market exits in this space in whole or in part. But since 2020, we've seen about 8 new entrants. What I think is probably most important when you think about that, however, is that, the markets that exited, many were long-term multi-line writers. They wrote leads and they wrote big capacity chunks. Most of the markets that have entered are not necessarily writing leads. They're not writing all lines, and they're not writing significant limits. So we definitely haven't seen the capacity that has left been replaced. But there's another important factor to consider, and that is this is long tail business. So when you look at the markets that have entered new, they have no legacy, and they have a little bit more room to aggressively enter this space and take advantage of some disruption. So I think we're in a much better spot than we were a few years ago. I don't think we're out of the woods, but I think we are, our clients are in better position than they were a year ago.
Christina, have you been surprised? We talk about 11 exits, but 8 entrants, but, people not putting up 15, 20, 25 million in capacity. Have you been surprised that there hasn't been even more disruption in the business?
So potentially there is more to come. So there's been some carriers that maybe came into the market strong in the hospital business, say about 5, 6, 7 years ago, and have they really experienced the claim activity that carriers that have been in the space longer have? So potentially more to come in terms of that.
Right. Are there anything else that you would add in terms of, you know, the way that Paula has talked about it here, where, hey, you know, maybe it wasn't so great 18 months ago, but now it's kind of stabilized. Are you also seeing the business that way?
Yeah, so some of the gaps in capacity with the new entrants, they're taking care of those gaps in capacity, but for programs with really large limits, there's trouble filling out those limits. Some clients have decreased limits as well, so that is a concern. And then in terms of pricing, still seeing pricing increases, and I don't expect that to slow for 2022.
Right. You know, one of the sorry, were you going to jump in, Paula?
I was just going to agree. I was going to say, I think, you know, we're continuing to see rate increase for sure, double digit. It's just not to the extent we did last year, for example.
Sure.
And again, I think it's just because we're getting there. So maybe an account, you know, that was taking 30% in rate last year is maybe seeing 10. But I think there's also some disparity throughout the tower. So on large tower programs, you know, we often see some almost inverted pricing or larger increases higher up. And I think that's a function of cost of capital as well as just the difficulty, to your point, to sometimes fill these towers.
You don't see that part changing. You know, whereas before, or do you in the next coming year or two?
I hope it continues to stabilize. I think, you know, like I said, as markets continue to get rate and start working towards profitability, which, you know, obviously the industry has not been in for, you know, 6-7 years, and that's really the result of where we are today. I think as underwriters start to get back to profitability, I think we'll see rates stabilize, but it might take another 12 months.
You know, so in the opening, we talked a little bit about COVID-19, just the general uncertainty that was in this market, not to mention the long-term care market, March 2020. What's happened since then, or how has it impacted claims? How has it impacted underwriting review, policy language? Maybe Christina, you could start in on that.
Sure. So in terms of asserted claims due to COVID-19, at this point, there aren't many in regards to hospitals. I see the larger concern in terms of the courts essentially being closed, and it could be 1 to 2 years to longer in certain venues for claims going to trial, for that to actually happen as the criminal cases are being handled first. So what are those claims going to look like? And in the meantime, we're in a period of social inflation. So is that going to drive the cost up, even for the values of these claims up even further? I also think COVID pushed along what we were already seeing, which was staffing shortages. So it helped speed that up with early retirements and people leaving the industry. So, I mean, that's going to be a concern in terms of care for patients. And then along those lines, burnouts as well, which it's a major cause of medical errors. So could you be seeing more claims due to that? And then also in terms of COVID, with either certain procedures not occurring or just due to the demands of COVID, not being able to offer certain services. So from that, will you see more claims due to failure to diagnose or failure to treat? Will there be an increase in claims from that higher than pre-pandemic levels?
But have you seen it change, or has it changed the way that you underwrite?
So in terms of the underwriting, taking a look at the claim activity, knowing that there hasn't been much in the past couple of years happening, taking a look at a larger length of years. So typically you could take a look at 5 years of loss data, but really understanding that the 2 most recent years might not be indicative of what is going to occur. So I think taking a larger perspective at 10 years in terms of the losses, in terms of how you price an account, what that history has been. And then I think it's also helpful to hear lessons learned from COVID. There's many good things that came out of it, emergency response, How are they handling staffing shortages, support for burnout, going through those various items as well.
Sure. Paula, how have you seen it affecting terms and conditions that people have offered? Or reticence to offer terms and conditions?
Yeah, good question to kind of continue off of what Christina was saying. You know, really the potential claims activity really stems more out of the senior care space because of the residential living component. And really, you know, the plaintiff bar continues to initiate suits in that space as opposed to more hospital or other providers. So I would say, you know, the market is taking a varied position, particularly based on class of business. So for example, you know, we're seeing outright COVID-19 exclusions or communicable disease exclusions in the senior care space, much less so in the hospital space. But, you know, it's very interesting because I think oftentimes there are exclusions or limitations that are hidden within other exclusions, such as mold or virus. So, you know, as brokers, we need to be very diligent in really diving into every layer of a policy, for example, or every reinsurance certificate. You know, where we're seeing some restriction, I'll say, has to do with more allowable reporting. So, for example, you know, many carriers are if they're trying to be more restrictive because of concern for a particular system, they might restrict batch COVID reporting or require a common nexus, meaning there has to be a true relatable event. It can't just be the presence of the COVID virus. Other carriers are trying to cap limits under multiple policy periods to a single limit to, again, kind of contain their risk in regards to COVID. You know, I think
have people had success doing that?
No, not in my experience, because I just think
Okay.
it causes a lot of disruption, right? You have gaps in programs if everybody's not kind of addressing it the same way. So no, I don't think that kind of combined single limit makes much sense in this market, particularly in the large hospital space. But I can understand the common nexus verbiage that, you know, it really should be a true relatable event to be reported as one, not just, you know, every COVID claim that had ever, you know, or every potential COVID event that have ever happened at a hospital being reported as one claim.
You know, it's interesting. You brought up how, you know, maybe it's not hospitals, it's long-term care. That's where really the focus should be. Many of these health systems have long-term care aspects or long-term care facilities within them. Have you seen any type of change in the underwriting of the systems because of that exposure, or is it too minimal?
You know, I don't think so. I think more than ever, just given the market, even pre-pandemic, we have been engaging our clients more and more to tell their story. And the underwriting process has evolved. I think that, you know, one of the areas of focus when we meet with underwriters is discussing COVID. And we talk about things like protocols, procedures for handling visitors, separation of COVID patients, screening of staffing shortage, contingency plans, vaccine mandates, and rollout. I think we're asking a lot more questions, operational questions specifically, that maybe we haven't even thought of in the past, to Christina's earlier point.
And really, as you review at least the more sophisticated healthcare systems nowadays, people are really doing the right thing. I mean, most of these, at least in terms of my, as I viewed some of these, and as Christina's talked, and I have talked about some of these risks, I mean, for the most part, this is an area that's been of primary concern and primary focus. Christina, have you seen any type of variability, or where you see a more sophisticated health system and they're just not doing enough in terms of prevention or management of COVID exposures?
Sure. So, I mean, as you said, I think healthcare in general is trying to do the right thing. There is going to be a difference between the size of an organization. Sure. So a larger organization is going to have more resources to set up supply chain management, which is one thing that came out of this. They're
Right.
going to likely have more access to providers in terms of staffing shortages, and they may have more of a weight in terms of mandating vaccines. Some of the smaller, more rural institutions are going to struggle with that a bit more, with concern over.
Oh, no, keep going. Sorry, go ahead.
Yeah, just with the concern over losing staff. It's harder to get staff in more rural areas, so mandating vaccines can have a larger impact than at a larger institution.
And a more robust technology platform is also going to allow for better telemedicine, telehealth, and reaching patients more probably rapidly.
Well, to that point, so you brought up vaccine mandates. That's been something that's really been in the news. Is there anything there in terms of health systems mandating vaccines for employees that has started to, whether it's trickled into the or gushed into the claims experience, or has it changed any of your underwriting approach? I guess, Paula, first, looking at what, all of the different carriers that you work with, are you seeing any concerns, questions, exclusions, anything related to that?
I think when you think about employee vaccine, particularly the mandate, it's more, I think, an overarching concern from an employment practice standpoint, or a potentially even employer liability standpoint, which typically falls under an umbrella, hospital umbrella. But I would not say that's the overarching concern. I would say that, for the most part, our clients are rolling out some pretty stringent guidelines because their top priority is patient employee safety. And that's a great thing. And I think the community recognizes that. But we do see some concern over potential, class action regarding mandates, but I don't think our marketplace is reacting in a negative way to date.
So, interesting thing about the mandated vaccines is CMS has set a deadline for Medicare and Medicaid certified facilities to be vaccinated in January. So that if that doesn't occur, then they're going to lose. It's going to have a financial impact. So that's going to push this even further in terms of the mandated vaccines.
Sure. One of the things that's been brought up as we've been talking in preparation for this discussion was cyber exposures, particularly as relates to hospitals. Initially, I think there was a move to really have it be proactively included. That's kind of tailed off, but there's still exposure. So, Christina, how are you seeing whether it's yourself dealing with the cyber exposures on a hospital professional basis, or just in Paula, how you're seeing other people dealing with it? So, Christina, I'd start off first.
Yeah, sure. So, digital transformation in healthcare is continuing to increase at a fast pace, and there's a lot of entry points as to where someone can come into the system. We've seen in the news, there's been a case in Alabama for treatment of a baby that resulted, an injury in that case.
But at this point, business interruption underwriting is not really part of, or is it part of the hospital evaluation?
No, so don't get into business interruption, but I think what's part of the cyber exposure with the hospital from the med-mal standpoint is, what is their plan if something happens? Are they affiliated with other organizations where they can transfer a patient? Do they have other ways of treating patients where typically they would use technology? Because the problem's going to be is a failure to treat and get them the right resources in terms of some of these cyber events.
Sure. Paula, as you see cyber exposure and you're going and talking to your clients about what they should be expecting from the HPL policy, is it always the same thing, or is it depending on the account or the deal?
Well, I mean, I would say the vast majority, if not all of our healthcare clients, vast majority purchase cyber liability coverage, and that's a multifaceted policy that does what it's,
Sure.
written and priced for to do. I guess first to begin, I'd say I don't mind being in medical professional these days because whatever kind of rate increase or hard market we're in the middle of, it's a lot better than cyber right now. But
Yeah.
but I think our policies do what they are intended to do. Our policies respond to rendering or failing to provide medical professional services, and that's the result of a bodily injury or emotional injury claim. So I think that the amendments to coverages or endorsements that have been added in the last 18 months or so have really been clarification. Clarification to state, what is covered, financial loss, you know, through a cyber policy versus, or even, monitoring and all of that, forensics versus a true professional liability, rendering or failing to provide care, which should be covered under the medical professional. And I think most markets are in agreement that, regardless of where the injury, kind of begins or stems from, that it should be covered under this policy.
Sure. Well, hey, we've got time for one or two more. I thought I would, one of the questions that came through was predictions for 2022. And whether it's, doesn't have to be a general prediction, it could be more specifically about the healthcare professional market. But Paula, do you want to start first?
Wow, let's see. I'm trying to stay positive. So I think that
Feel free to be negative.
I think to Christina's earlier point, we might see a few more exits or restraint or pullbacks in the market. But I also hope to see some other new entrants. I think, as I mentioned earlier, this is, kind of the time is ripe. It's long tail business, and to be able to enter without, legacy, I think puts many in a great position to really kind of take advantage of a downward turn in the market. I also think there's going to be continued recrafting of language in regards to certain restrictions, such as sexual abuse, molestation, just kind of given the claim activity and the national focus, not just in healthcare, but with the Me Too movement. I think we'll continue to see some of those types of topics evolve. And I'm hopeful that we'll see, the market respond in a positive way to provide some coverage as well.
Great, that's great. Christina, how about yourself?
Yeah, so I think we're going to continue to see rate increases and increases in attachment points, with ultimately insurers having to make a decision as to their risk appetite. And also to what Paula said in terms of clarification on coverage terms. So a large concern is around systemic events. So if you have a sexual abuse claim, larger batch claims, so getting some clarification around that and how that is going to be handled, I kind of see as the next step, because that continues to be a large concern. And how do you handle those? How do you price for those? You can't necessarily price for it. So gaining some clarification would be helpful.
I got one follow before I let you guys go. I've got one follow-up that was asked, and it was, what structures and strategies are insureds taking to protect their business because of the hard market and the pandemic? So Christina, you were alluding to it a little bit. You're seeing people driving on higher retentions? But anything else to add?
Higher attachments. I mean, in some cases, they're coming back in at a higher layer and taking that risk on for a portion of a layer. I mean, they're moving to more captives for policy language control to get the benefits financially if they are increasing retentions, and they don't have the extra cost added in that a carrier would have. So that provides a benefit for them to move to a captive as well.
Great. Paul, anything last to add on that?
I don't think so. I mean, I think Christina covered it.
Okay.
Definitely more captive utilization, risk sharing, and then we probably see more and more programs with some quota share or multiple participation to kind of spread the risk and economies of scale.
Awesome. Well, hey, it's we ran a tiny bit over, but Paula, Christina, really appreciate it. I thought this was great. So thanks a lot, and hope everyone else enjoyed it.
Thanks for the
Thank you.
opportunity.
All right,
Sure.
thanks, Adam.
Bye.
Bye-bye.